Well, thank you so much, Chair, and thank you to the folks that are left over to chat with us a little bit more about Veterans Affairs. I will allow you to decide who the best person is to answer, but if you don't answer soon, I'll have to bother Mr. Harris, I think. So that's just a little heads up. So one of the concerns that we've heard, especially during our study on women veterans, is that there's a concern about identifying any preventable causes of sex-specific illnesses and injuries in the CAF. So what women are calling for is for VAC to communicate to CAF the lessons learned from the first few decades of service by women in operational roles and environments. And I'm just wondering if the department has any plans to work together with CAF to prevent unnecessary sex-specific injuries and illnesses among military women. And if so, could you elaborate on how that might happen? And if not, can you explain why? Going
sure,
once. Oh, Mr. Harris, it's good to see you.
It's nice to see you, even though I feel like a leftover. The answer to the question is we do actually what you've indicated already in terms of communicating back and forth and working with our Canadian Armed Forces colleagues on anything that we see as a trend line. This happens for women or men veterans. If we see changes into the kinds of applications that we're getting, if we see specific kinds of things changing, we do communicate. We have a health professionals group in my own organization that works very closely with the Canadian Armed Forces Health Services Group as well to identify.
Well, Mr. Harris, thank you. You answered my question. So the next question that I have is, could you provide the committee with the trends that you're seeing specifically around women and sex-specific injuries and illnesses, and what you've identified as a trend as you just spoke about?
Sure, and so what I was talking about from a high-level perspective is the groups work together to share any information, and so if we see trends that are different between men and women veterans,
that is excellent. So you're going to table that with the committee?
I can share information back with you. Yes.
Thank you so much. I really appreciate it. So we know that women veterans are calling for reproductive health research that follows them from military to veteran status, while also capturing the possible health impacts that their service had on their offspring. Of course, I hope everybody in this room has heard the testimony from the women veterans and how important this is. So I'm just wondering what the department is doing to ensure that women's reproductive health is considered in the health coverage and services provided by VAC. And I just want to remind everyone here the question that I did ask the ministers. One of the challenges, of course, is often women are not coming forward, or when they do come forward, the assessment isn't done properly around their health care. And, for example, we heard that some women were getting breast reductions to wear their kit. So when these things happen, I just want to know, is that actually being followed up? And what is VAC doing to address these specific reproductive health issues that have been a consequence of their service, and how is that communication happening between CAF and VAC to address it? I'm assuming it's Mr. Harris again.
I might start, and I might ask Mr. Tessier to talk a little bit about research from that point of view. We are consistently looking at the testimony that appears here. We look forward to the recommendations and the report that comes back from the committee on this very extensive research into women's health. With respect to whether it's reproductive health or women's health overall, we continue to examine existing research, new research that's done within the community, within the Five Eyes community as well, and others.
Okay, can I just pause you there?
Yes, absolutely.
Thank you. Sorry, interpreters. I'm trying to do this as well as I possibly can. So I guess my question, just for clarification, is you're talking about reviewing other research done with our partners. Could you reference any research or commitment to research that Canada has around these particular concerns?
And in this case, I might ask Mr. Tessier to respond to the kind of research that VAC undertakes and is able to do.
Perfect. Thank you, Mr. Chair, for the question. As we work very closely with our CAF health professional colleagues, we do look at research that's underway in the CAF, research that's underway within VAC, some of the future VAC projects around specifically this area that I have here today, examining barriers to service for LGBT purge survivors, investigating women veteran reproductive challenges, specifically looking at that issue, and further researching, and scoping new intimate partner violence among veterans. So continuing that research, working very closely with our CAF colleagues to exchange the research so we don't duplicate research and build off what we have.
So we've heard through testimony in the women's study that one of the challenges is that there's just not enough Canada-focused research on both sides. So I guess the follow-up question to this is just what is the commitment to invest in this research, and how are you collaborating, or how is the department collaborating with CAF to make sure that the research is done on both sides so that we can see that collaboration between the service of and then the response after service?
Definitely. Thank you for the chair. Thank you for the question, Mr. Chair. What we've done in the 18 months that I've joined Veterans Affairs is we've formed actually a research and policy ADM steering committee and DG steering committee to review the research that is happening currently, research that's being planned, so we can build off of that. And the research that I've mentioned is definitely in the looking to be in the pending and approval stages. So definitely committed to this research, but also looking at looking forward to the study on women veterans that's occurring today as well, and taking some of those recommendations into our research as we have it today.